Hundreds of people have gathered in Durban for the march to Gugu Dlamini Park ahead of the opening of the South Africa AIDS Conference later today. The South African National AIDS Council Civil Society Forum is set to launch a sexual and reproductive health rights campaign called the Love Picketing Campaign. SANAC Civil Society Forum coordinating member Mabalane Mfundisi says the Love Picketing Campaign seeks to promote access to quality healthcare services and awareness about sexually transmitted infections, voluntary male medical circumcision and contraception. Over the next 4 days, scientists, NGOs and policymakers will be meeting at the AIDS conference to reignite a multi-stakeholder approach to fighting HIV in the wake of the COVID-19 pandemic. Let's get more on the story with SABC News reporter Jayed Paulse in Durban. A very good afternoon to you, Jayed. Just take us through what's happened and what you're expecting for today.
Well, a very good afternoon to you, Nzinga. And yes, the march has actually arrived at Gugu Dlamini Park. We started at King Dilizulu Park this morning, and we are here awaiting the Health Minister, Jayed Paulse, to address members of SANAC as well as members of several NGOs. Sex workers are also here, the LGBTQI plus community also here, and we are waiting for the Minister to address them and speak about what is happening and the efforts to fight the scourge of HIV and AIDS. And this is all ahead of the AIDS conference that is taking place at Albert Luthuli International Convention Center. But to talk more about the prevalence of HIV amongst young women, I am joined by Jenny McLaughlin. She is from the TB and HIV Care. Jenny, thank you so much for joining us. You know, you and I spoke off camera earlier on, and you were talking to me about the fact that although there is so much information and education readily accessible to young people, unfortunately, young people are still finding themselves infected with HIV, and here in KwaZulu-Natal, there's a high prevalence of that.
Yes, that's absolutely correct. So really, we found adolescent girls and young women at higher risk of HIV acquisition than their male counterparts. And some of the reasons for this is really starting with peer pressure, where young women often find themselves in a situation where they are really coerced to have earlier sexual debut. Another reason for a higher risk of HIV acquisition is around gender-based violence. The rate of gender-based violence in South Africa, where young women don't have the power to negotiate condom use or don't have the power to say no to sex. Another reason for high rates of HIV in South Africa and in KZN is also around poverty. So we really need to have a multi-sectoral approach to the individual, to the young person, that we also deal with their parents, their guardians, the larger community and the male sex partners. Another reason for high HIV acquisition is really around I think really stigmatization. So young women are really often stigmatized by healthcare workers. So by bringing services to young people, to making services accessible to young people, is really something that they ask for. They also want to be treated by a young service provider, someone that they can relate to and really can get guidance from. So young people really are at much higher risk than their male their male counterparts. Other reasons for a higher rate of HIV acquisition will be also
Okay, let me come in there, Jenny. I wanted to ask you also about, the accessibility of treatments in a province such as KwaZulu-Natal, and you are a nurse. Yes. Talk to us about the distribution of PrEP. Not everyone can access it.
Okay, and that's absolutely correct. So PrEP is offered at every health facility in KwaZulu-Natal, and PrEP is even taken out on mobile vehicles so that we can bring access to PrEP closer to people at risk of HIV acquisition. So PrEP medication is available. Service providers are providing the services, but often young people just don't have enough information around prevention interventions like this key intervention around PrEP. So that definitely is one of the reasons, why young people end up, getting HIV, just because now they don't know enough about PrEP, and then it's also not accessible in some areas. Yes, yeah.
Thank you so much for joining us, Jenny. I think this is going to be the talks throughout the conference that will be kicking off later this afternoon. My colleague Binoshli Pillay will be covering that leg, and really speaking about the distribution of a treatment like Jenny spoke about there, and also the stigma. It's so symbolic that we're still talking about stigma so many years later. Gugu Dlamini, and where we are right now, the park named after her, was the first individual in 1998 to come out and disclose her status to the world, speaking about AIDS, which was then something that not many people knew about, and the community in KwaMashu actually stoned and killed her, and that is why this park where we are stationed right now is named after her. So it really is symbolic, and it's so sad that we're still talking about a stigma so many years later, but this will all be unpacked throughout the course of this week as the AIDS conference kicks off at the Albert Lutuli International Convention Center. Healthcare experts, health professionals will be discussing ways to fight this, but also innovation, technology, and so much more. It's back to you in studio.
Jayed Paulse, thanks for that update from Durban.